Good afternoon, everybody. We are RAMP, Real Access Motivates Progress, live Wednesday podcast. We are a little bit early. We are in the middle of the afternoon because we have an important event that we have to be at tonight. But I am so excited to introduce my guest and my buddy from Leadership, Rhode Island, and tell you all about the Rhode Island Free Clinic. Welcome to the show, Forrest.
Hi, Tina. Thank you for hosting and having me on the show.
Oh, I'm so excited. We are both in the Tau 2 Leadership Rhode Island class this year, and we just so happened to get buddied up, and I could not have asked for a better buddy. We are so amazing, so I'm happy. But for everybody who doesn't know who you are, Forrest, tell everybody who you are and what you do.
Sure. So again, thanks for giving me and Rhode Island Free Clinic really the opportunity to speak to your audience. But so I'm Forrest Daniels. I was born in Florida, and when my dad was getting his doctorate at UMass Amherst, our family moved up to Amherst, and when I was in fourth grade. So and I was pretty much raised in Amherst from fourth grade until high school. Graduated from high school up there. So I'm not a Rhode Islander per se, but I'm a New Englander, right? I'm still in touch with my scoutmaster from decades ago. Like to say that at least 75% of my Facebook friends are from high school. I was just up in Amherst last summer for my 41st high school reunion.
Wow.
Yeah, I know. It's been a while. But it's all good. But my dad, again, was a university administrator. My mom was a retired nurse. And so for me, I've kind of got into this healthcare thing back in 1990 after having gotten an undergraduate degree in accounting from Howard University. Then I went to Indiana University to get a Master of Public Affairs with an emphasis in Health Services Administration. But I did a summer residency at University Medical Center out in Las Vegas. It's more commonly referred to as UMC, and that's the hospital where you all might recall several years ago there was a massacre that occurred back in Vegas where they sent a lot of the patients there. It was a level 1 trauma. So I was there for a summer, and then when I finished my graduate studies at Indiana University, I got accepted to Northwestern Memorial Hospital in their administrative fellowship program. So I did that for a year. And then I get introduced to community health and kind of got that bug, as they say, federally qualified health centers. And so from that point on, I've been focused on the medically underserved, working poor, and uninsured throughout my healthcare career. So I'm honored to be here in Providence, Rhode Island, the Ocean State.
Oh, I love it. I absolutely love it. The Ocean State is one of my favorites. I would like to get to the ocean. So one of these days we will actually make the ocean and the beaches a little more accessible. But the Ocean State, like I said, I've moved around myself. Most of my family lived in Canada. I've lived in California. So I have been across this great country.
Okay.
But we always come back to Rhode Island. I don't know what it is, but we can all complain about it, but we always get drawn back in.
It's a beautiful
it is
state.
what it is.
It's a beautiful state.
Yeah. So tell everybody a little bit about the free clinic and why it's so important.
Yeah. So we are celebrating our 25th year. The Rhode Island Free Clinic was founded back in September of 1998 by a group of individuals, but the visionary behind it is Stephanie Chafee, who was also the former First Lady of Rhode Island. The whole concept at the time was to bring volunteer providers to come in to provide quality medical services to the state's medically uninsured adults. And that has been the mission from day one, and that has continued to this day. We've expanded the mission slightly to include serving as a primary teaching site for aspiring healthcare professionals. So we are also the Northern Rhode Island Area Health Education Center, or AHEC, and so that's what we do here at Rhode Island Free Clinic.
That is absolutely amazing. And I know it's accessible because we did our accessibility roll through because Forrest thought that once he met me and we became buddies, he decided to make sure. And few minor tweaks. I mean, I can't say that it's not accessible. We did a few minor tweaks, but for the most part, it's all good. But what are some of the clinic's needs? Like, what are the most things that people could help out with that are their needs that you could use some help?
Yeah, so we provide medical, dental, and behavioral health care services to, again, the state's medically uninsured. And we do that through a volunteer model. We rely on volunteer dentists, volunteer doctors, volunteer medical scribes, volunteer interpreters, volunteer medical assistants. That's what we rely on to provide care to our patients. Um, we have a very small core staff, which we raise 100% of our funds through individuals, some grants, corporate grants, and foundations. But we don't bill private insurers like Blue Cross Blue Shield or United. We don't bill them. We don't bill the state, which is Medicaid. We don't bill them. We don't bill the feds for Medicare. We don't bill them. We provide services out of love. Men and women who come here and give of the most precious asset, which is their time, to provide care to men and women who might otherwise not get it. And so the greatest need for us, aside from resources, financial resources, folks to volunteer, healthcare professionals who are willing to volunteer, within the walls of Rhode Island Free Clinic.
So if you're out there and you have some time to give and you want to give back, come meet my buddy Forrest, help out at the Rhode Island Free Clinic.
Yeah,
But how does one
if I
become
can.
a patient?
Okay, so great question. But also in terms of folks, if they have an interest in volunteering, they can go to our website, right? rifreeclinic.org and click on, there's a drop-down menu about volunteering. And then they will be connected to one of our AmeriCorps Vistas who will walk them through the whole volunteer process and onboard them. So it's pretty seamless. But to your question, in terms of how one becomes a patient of ours, they must meet several criteria. One being income below 200% of the federally poverty level, which is about $26,000 to $28,000.
Wow.
Right. They must be a state resident. Okay, and then basically those are the two key criteria that must be met. We don't ask for documentation status. That is not a concern of ours. We're concerned with the health of the human being. And then we have our behavioral health staff that will do enrollments of the men and women who aspire to be a patient of ours.
That's amazing. When I look aside, I'm answering questions because we do have a lot of people watching us live right now. One of the questions that somebody just asked, where is the free clinic located? And can you live anywhere in Rhode Island to utilize the free clinic, or do you have to live in the area of it?
Great question. And thank you, whoever submitted that question. We're located at 655 Broad Street, which I've been told it's considered Upper South Providence.
Now that's a different location.
Yeah, Upper South Providence. But yeah, so 655 Broad Street. And so as a landmark for those who are from the area, it's right next to St. Joe's Hospital. Okay. And we're in the Hindle building. There's a whole medical professional building. And the clinic is on the third and half of the second floor. And as Tina mentioned, we do have an elevator, wheelchair accessible elevator, and things of that sort. But you can we serve the entire state of Rhode Island. So one does not need to be in Providence to be a patient of Rhode Island Free Clinic. The last data I saw, we served patients from every county but one in the state. So, wow. Yeah. Yep.
That's amazing. We're going to get most of our questions from online. So, because we have a lot of people who are very interested and looking. Is there anything like what happens if they go to the free clinic and they're diagnosed with something that you can't handle? How do you get them into the system, or how does that work?
Again, great question. And thanks for bringing that question. So we can't do it alone. Again, we are a volunteer model. So we have relied on community partners. For instance, Rhode Island Hospital helps us with diagnostic tests, things of that sort, other and mammographies and things of that sort. So we rely on other community partners to provide the needed service for our patients, and that's how it gets done. We also have, I mentioned we do dental here. We've got like one of the state's best top periodontists and oral surgeons that comes here to see our patients, and they will perform some very complex surgical procedures in our 2 dental laboratories, and that is in our dental operation is headed up by Dr. Mary McCabe, who is just an outstanding volunteer medical or dental director for us.
That is amazing. Like I said, we're getting our questions from online because
all right.
People
Beautiful.
are interested. So I'm not putting you on the spot here. So
Beautiful. Thanks for the question.
And if you don't, we'll find, if we can't answer one of your questions, we will find the answer for you.
Yeah.
But somebody wants to know, with all the homeless that are on the street that happen to be utilizing mobility aids, I'm paraphrasing this question.
Sure.
Obviously they have some kind of, already pre-existing condition. They're now homeless. They don't have the option to go to their doctors. Can you help them get their prescriptions or get back on their prescriptions, knowing that they already have a pre-existing condition?
Right. Again, great question. Thanks for posing the question. So we don't do that. But there is, like Crossroads, I'm familiar with them more specifically. They have a relationship with, I believe it's Providence Community Health Center, a partnership in that regard. So for the homeless population, that's the access point. And I don't know if Crossroads has a healthcare for the homeless grant, which is something that is issued through the feds, through the Bureau of Primary Health Care, and HRSA, the Health Resource Services Administration. And those are pretty significant multi-million-dollar grants that are available to healthcare providers to render care specifically for the homeless population. But we don't do that.
Well, the one thing, Crossroads is amazing. They do so many things for Rhode Islanders. The one problem that, we have is issue. It's not really all that accessible. So those for my population, Crossroads isn't really that much of an option. Number one, you have to be split. Like if you're a man or woman, you can't be together. So now you're disabled and you're leaving the one person who knows how to take care of you. So, and then it's not all that accessible. So we need to figure that out. Maybe that's something we can work on together, with the free clinic to help those people, at least guide them to the right places to go and have that done. What are some of your greatest accomplishments, you think, through the free clinic? What are some of the big feats that you have overcome?
Yeah, well, I think the fact, one, that the organization has been here for 25 years, first and foremost, okay? It was not a small feat, right? So when the vision was first set forth by Stephanie Chafee, and then she was able to talk with some other friends, colleagues, and then they had to convince, a whole bunch of people, right, to say that there was a need, and two, that it would benefit, Rhode Islanders who were medically uninsured. And so the fact that, the need has been proven, and, for 25 years, that's one.
Right.
We've also been able to show that Rhode Island Free Clinic is saving the state approximately $4 million of preventable ER visits, right? Because persons can come to see us rather than going to the emergency department. The services we provide, those are huge accomplishments. Primary care, the dental program, which we just were able to bring on. My predecessor, Dr. Marie Gazal, was able to, and our late Marvin Ronig, were able to get a grant with the support of Delta Dental in 2018. And so that's been huge. We've been able to formalize a behavioral health program, right, with with a full-time person last year for the first time. We've had volunteers to serve in capacity of behavioral health, but now we've got a full-time person. So those are one of many, or several, I should say, several accomplishments that we're all very proud of. And, the fact that we provide that care to our patients. I mean, that, at the end of the day, it's really what it's about. And
you can't beat what the free clinic does. And, one thing I want to make sure that I point out to our viewers is you do not charge for anything to a patient.
correct.
The patient, it's 100% free. So without getting donations or funding or help from others or people who can afford it, there are so many Rhode Islanders that will not get the care that they need because the free clinic will not be able to continue going on, because just because they don't charge the client doesn't mean that they don't have course, that they don't have things that you have to pay for. Tell everybody a little bit about that, of how they can get involved and how they can donate and how they can keep the free clinic going for 25 more years is what, and longer is what we would like to see.
Yeah, thanks. So the latest numbers I've heard, there are about 45,000 medically uninsured adults, uninsured, I should say, in the state of Rhode Island, right? We see on average 2,500 of those men and women on an annual basis. And again, 100% of our dollars are raised by individuals, corporations, grants, and what have you. And so folks can go to our website, rifreeclinic.org, and there's a link there to donate, to learn a bit more about ways in which you can support us. We certainly appreciate it. And if you can't give, maybe you can share what we do with someone else, and they might be able to give. But so the word of mouth, getting the word out about the impact that Rhode Island Free Clinic.
We're Rhode Island, everybody knows the guy.
Yeah, right. Yeah, right. The 1 degree of separation, right? And so, so that's really something very, very important for us to let people know that we exist. And to one of your viewers' first questions was whether or not you had to live in Providence or in the area to receive care. No, as long as you're in the state of Rhode Island, we welcome you to be one of our patients, provided that you meet the eligibility criteria.
It's amazing. Like I said, I can't get over what you do and how you can help it. But here's another question from our viewer. If you're a diabetic and you don't go to your doctor anymore, can you help those? Like, let's rephrase this question. I'm going to expand your question a little bit. What does a typical appointment look like, and what kind of things do you interact with? I'm trying to be politically correct here.
Yeah. So listen, so great question. Again, thank the viewer for submitting that question, because a lot of our patients are hypertensive or diabetics, right? And so we've just partnered with Rhode Island Pharmacy Association, where they are focusing in on some of our patients with the highest, most elevated hemoglobin A1Cs, right? And so we are very focused on providing the necessary treatment and care to those patients with those chronic diseases. We, in terms of medication, let me get to that as well. We are in the process of securing this arrangement with Lifespan, who's been a great partner of ours, and they have entered into an arrangement with a larger medication dispensary. It's called Dispensary of Hope, and what that will entail is that Dispensary of Hope will provide meds to Lifespan for our patients, and Lifespan will dispense those meds, if you will, and then they will send them to us via courier. But the important thing to that question that someone just asked is this includes insulin, okay, which is huge. It's costly, but those are the kind of arrangements that we actively and aggressively look to provide for our patients, so that all the medications that they need, we can provide to them at no charge. We're going through a little glitch now, and we've been very fortunate to have a long relationship with CVS as well with some of our meds, but that is currently being readjusted, if you will. But we're still very fortunate to have that relationship and partnership.
That's amazing. Here's another question. Somebody online is a veteran. They live very close to the clinic. Getting to the VA or those kind of hospitals are kind of tough for them. Would you take veterans even though that they have another outlet at your clinic, or do you help them get to the veteran services that they need?
Yeah, so thank you for that service, for your service, whoever you may be. Thank you. So we don't provide services for those who are not our patients. The demand for the services that we have are already, we don't have the capacity, quite honestly, to meet the demand. So we're really almost hyper focused on the 45,000 medically uninsured persons in the state of Rhode Island. If in fact you need something, like a referral or some idea, or recommendations or something like that, I mean, our behavioral health team could provide some kind of assistance, but we really wouldn't get as heavily involved with case management or in that regard, because you wouldn't be our patient, and we really want to devote our time and efforts to our patients.
Well, I think we have a policymaker watching us today, because this is another policy question.
Okay.
For you. So this is a good one.
Thank you for the policymaker.
This one caught my eye because I'm working right now with the Department of EOHHS about the whole Medicare and Medicaid unwinding and re-upping everybody.
Yes.
You
Kyla's been talking about that.
Yeah. Are you fear or nervous that a lot of people who are going to drop off the system or be forgotten out of the system are going to flood you with services? And how are you planning on, managing that?
Yeah, so that is a concern that, our colleague Kyla and Jim from RIDO have expressed. And it is a concern. It's a statewide concern. Certainly a concern of ours as well. The only caveat is that, again, we only serve patients when we have volunteer providers, right? So when COVID hit, it had an adverse effect on the number of volunteer providers that we had. So we're really operating at 25% fewer volunteer providers than we had pre-COVID. So our capacity to see more patients is already strapped. So all it's going to do is increase greater demand for our service. And unfortunately, we're not going to have the men and women volunteer providers to meet that demand. So it's going to be tough.
So in other words, what you're saying, that if more people step up and fund you, the larger capacity you will have and the more people you'll be able to take care of. So what we're actually saying to all of you is, if you can donate, help out, support, lend your time, lend your expertise, give a few hours a week to making sure that you're helping keeping them going, and help raise their capacity to help all of our fellow Rhode Islanders who are struggling at this point. All of us could give a couple of hours a week. All of us could give an hour, or use our networks. We have networks for a reason. And again, we make fun that everybody knows a guy in Rhode Island, but it's so true. Somebody that you don't know would be related could really help out this clinic, could really help out the Rhode Island Free Clinic, could give services, could give funding, could give anything. So just by sharing all of this, you could be making a difference that you don't even know that you're impacting, because we want to raise their capacity, because with the Medicaid unwinding, we're all nervous. We're all scared. We all don't want anybody to fall through the cracks, and we don't want the free clinic to have to turn anybody away because they're not having the capacity. What are your thoughts on that?
Thank you, Tina. And so to your point, and that's a great point. In 2021, we had the fortune of having a conversation with folks from Brown Medicine, and they recognized some of the challenges that we were facing. And to their credit, under Dr. Lou Rice, and now under Dean Mukesh Jain, they have dedicated zero point 0.6 FTE of primary care providers to Rhode Island Free Clinic. Huge, very, very significant. Among that 0.6 FTE is one gentleman by the name of Dr. Ross Hilliard, who serves as our volunteer medical director. That gives us stability, infrastructure, right? And so, but that's coming out of Brown's dime. And for us to raise money, if we were to do that on our own, it'd be very challenging, right? So to your point, certainly any contributions folks can make to us, greatly appreciated. And then when you go to our website, you again, there's the donate button, but also let me just mention that on October 19th, we're going to be having our founders event, which is celebrating our 25th anniversary. And when you go to the website, there is sponsorship form and what have you that persons can see, and encourage you to consider, sponsorships at any level. And again, just spreading the word about what we do and the impact that we're having on, our fellow Rhode Islanders would be great.
Yeah. You've already touched on this question a little bit, but I think our viewers want you to expand a little bit.
Okay.
How are you tapping into the local academic colleges and the surroundings to help support the clinic while helping them learn?
Oh, excellent question. Thanks for that question. So as the Northern Rhode Island Area Health Education Center, AHEC, that is the vehicle that we use to partner with most all academic institutions here in the state. So you name it. I mentioned Brown, but certainly CCRI, URI, Bryant. I was just at Bryant a few weeks ago at their School of Health and Behavioral Health Sciences. I believe that's what they're referring to it as. But Rick, Rhode Island College, Providence College, you name it, New England Tech. So we have those relationships. We have students, let's say at New England Tech, who come in through physical therapy. We're just working with URI to solidify having nurse practitioners come in, and also at Bryant for physician assistants. So we have those relationships, and we're always looking to bring more. So yes, that's very, very key to part of our mission.
Well, I have two New England Tech students right here in my house, my son and his girlfriend. One's going to be a paramedic. One's graduating to be a nurse in June. So we can tap into their resources, and we can see if we can send more your way, or when they were doing all of their blood pressures and all of their clinical work that they had to get, maybe we can send them your way to get some hours in and volunteer some time.
Yeah, well, that's what happens with a lot of our medical assistants. They're volunteers, men and women who are students, right? And they're here for that very reason. And we don't just put them into a space where they're seeing our patients, unsupervised, right? So our primary responsibility is to provide quality care to our patients. So, as long as the men or woman who comes in here to volunteer is committed to doing that and provides that quality care, we're all good, right? So
yeah. Some people want some clarity, so we're going to ask a couple of clarity questions here.
Okay, bring on the clarity questions.
The first one is, could you repeat how you can become a patient of the clinic?
So you have to be a resident of the state of Rhode Island or earn less than 200% of the federal poverty level. Okay, and again, that's around $26,000 to $28,000. And then our behavioral health staff will go through an eligibility screening to verify one's eligibility to become a patient. Once that's established, then they are held in the queue for one of our nurses, our registered nurses, to actually triage him or her to find out really, get some baseline information in terms of their health status. And then from there, the nurse will assign them to a respective primary care physician for clinical oversight.
That pretty much answers the next question. We're going to ask it just in case we missed something.
Okay.
Can you use the free clinic as a primary care to
Ooh,
follow up and to make sure that they're staying on top of, what they're supposed to be staying on top of once they establish as a patient?
great question. Great question. Thank you.
We got some great people online today,
No, listen, thank you
making
all.
my job very easy.
Yeah. But thank you all for viewing and supporting. What Tina's doing. It's very, very important, and supporting this show. But geez, I'm like just that quickly. And the question, I forgot about the question.
Oh, once they're established as a patient with
Oh
you,
yes, thank you, thank
can
you,
they keep following up with you? Can they use it as
thank you.
primary care?
Yeah, thanks. So yes and no. Okay. Um, when someone is medically uninsured, I kind of, and I've been toying with this as well because I served on the board of a homeless shelter, and in the homelessness space, they say homelessness should be rare, brief, and non-reoccurring. And it's my sense that if individuals are medically uninsured, they too, or that too, should be rare, brief, and non-reoccurring. So when they come to us, we want to make sure that we stabilize their medical condition, right? Uh, and then help them to hopefully, receive additional income so that they can be insured, and then be transitioned to another healthcare provider at that point. But we want to make sure, though, when that occurs, that there's like a warm handoff, right? So we don't want any patient, man or woman, to fall between the cracks. One of the things that we're in the process of flipping the switch in the next month or so will be to be a part of the state's health information exchange current care, right? So when a patient comes to us to receive care, and then they get insurance and they go to, let's say, Providence Community Health Center or another private provider, that physician can find out the care that they received at Rhode Island Free Clinic through current care. And so that's really the best in terms of quality care that we can
Right.
provide and stuff like that. So yeah.
So it's also a way to keep track, if I'm thinking of this correctly, it's also a way of helping people get enrolled into our state program at some point if they can be eligible. So it could be a
Yes.
pathway
Yes.
to actually getting them properly enrolled.
Correct.
Correct?
Yes. Yes. You are right. You are right. You are right.
See, I pay attention.
You are right. And so most patients, the patients that will stay with us the longest are ones who are, let's say, undocumented per se, right? But other patients who are here, then our goal is to help them, become eligible, right? And that's wraparound services. We've got a dynamic behavioral health team, and led by a woman by the name of Chrisani Navarro, who supervises students from Rhode Island College, BSW and MSW students, and who are
Right.
bilingual and things of that sort. So we want to ensure that we provide culturally competent care as well, right?
Yeah. Our next question
Oh,
is
great.
immigration status. Does that play a role in if they can get care or not?
No, plays no role.
So do you even ask so people can feel confident that when they're going to go there and they're going to go get treated, that they're not, because I know that's a big worry of a lot of people, of going
Yeah,
to a state agency or to going somewhere where they're going to get caught now or they're going to get in trouble for their
sure,
immigration status.
sure. It is. It's a concern, sure, but that's not our concern. Our concern is the health of the human being.
Okay.
That's
And
our.
can a whole family come?
No, they
No.
can't. They
Okay.
can't because we only serve. Thanks for that question. Great question. But we only serve adults, so we don't serve pediatrics, and that's a misnomer actually. So again, thanks for that question because there's an individual who had been a supporter of the clinic for many years, who paid a visit last year, and they thought that we saw kids. And so, we have an opportunity to better educate the community as well that no, we don't see kids. We only see adults. Yeah.
So 18 and older. Now, what happens if, where do you send the kids, or where do the kids go if, they're worried about their immigration status, they're worried about them, child protective services coming in because they don't want to feel they want to have their children taken away from them because they're trying to get the care. Where do the people bring the kids?
Yeah, that's a great question. I don't know specifically, but our behavioral health staff would know, right? But I also believe that the kids are insured in the state of Rhode Island, if I'm not mistaken. So it becomes less of an issue in that case because they're insured, right, under Medicaid, right, or state plan, whatever the state plan might be referred to for kids here.
Right.
So, decades ago in Illinois, they had a thing called Healthy Moms, Healthy Kids.
Could you help guide people to get there? Like if they just came into this country and their kids aren't registered or listed anywhere, could you help them, guide them to get their kids on the Medicare?
Yeah, so we could, but if they were a patient of ours, right, and that was a concern that they had, sure, we would do that. But I'd also mention to the audience that Dorcas International, which is, that's the premier, from my understanding, like the premier organization in the state of Rhode Island to provide resources for immigrants who are new to the state and what have you. So they would probably be, an even greater resource. But certainly for our patients,
right,
whatever the concerns that our patients present with, our behavioral health staff are here to provide the additional resources and support that they need.
That's great information for the Rhode Islanders who may not know that whether you've lived here your whole life or you're coming in here, children under 18 are covered in the state of Rhode Island. They will be able to get health coverage and to get care at, you're bringing your children in, so you're doing the right thing by your children. So there should be no fear there. Getting your kids the help that they need, even if you may not have coverage, they would be covered to make sure that, you're getting help. All right, we're gonna slowly wrap this up, but not really yet. Tell everybody, like, the most important things, the top 3 things that you think that they should really know about the free clinic that they probably would suspect.
Okay, one, that we do not bill. We do not bill private insurers. We do not bill the state for Medicaid. We do not bill feds for Medicare. That's one thing. 2, for those who volunteer providers, they are covered under the Federal Tort Claims Act, FTCA. So medical liability is a non-issue. They are covered because that is a concern that some providers have. If I volunteer, what about my medical insurance? It's a non-issue. So we have a process in place where we will submit their information to the feds, and they fall under the FTCA. The third thing I'd say is just the need for ongoing funding, right? Sustainable funding. And that is very, very key for us for the years to come. And if we can.
It must be exhausting to you knowing that you want to keep this clinic open, you want to keep serving your client and doing that side, but you're always constantly fundraising to making sure that everything. So it's like, that fine line down the middle, like, do I have my fundraising hat on today or I'm running the clinic? How do you deal with that? I mean, it's a difficult situation to be in.
Yeah, but I've been in this role now just over a year, and I'll say that my predecessors, Marie Gazal, whom I mentioned earlier, she was at the helm and she had to do it, and I'm just fortunate to be in this place to take it to the next level. And then we just had a dear colleague, Marvin Ronick, who passed unexpectedly in November of last year, and then hundreds, dozens of other people who've been supportive of the clinic and to get us to where we are. But it is what it is. And, if there's a way that we could become a part of the state budget, that would be huge, again, for sustainability. It's been proven that Rhode Island Free Clinic needs to be here and the benefit that it provides to the state, no doubt about it. And so what we love to be able to see is that we become baked into the state budget and receive, a constant stream of funds to ensure long-term sustainability.
Yeah. Well, I can honestly tell you that they couldn't have a better person in this role. I am so glad that we got to be partnered up and we work so closely together. And I can't say enough about you because I will do anything to help make sure that the Rhode Island Free Clinic stays open because it's so valuable to all the Rhode Islanders out there that really need what you're doing. Give everybody the address again so they know where you are.
Sure. So our physical address is 655 Broad Street in Providence, right next to the St. Joe's Hospital. And our website is www.rifreeclinic.org. And you can click on that, find some information, and feel free to reach out if you have any questions. See us as a resource. And if we don't provide the service, we will direct you to an institution or organization that does. So see us as a resource.
And if you're a doctor out there, please volunteer your time. If you have the means out there, please donate some funds, please. If you don't have the means, share. Make sure, because you don't know who on your social media has the means, has the heart, yes, or has the ability to know a doctor, know a nurse, know somebody who has a specialty, know somebody who has funds to help keep the free clinic open. You may not need it right now, but everybody is falling on hard times, especially after the pandemic. Businesses are closing. People are losing so many things. The Medicaid unwinding is happening. Mental health of the country is in dire need. They need these services. So my plea to all of you is you can always do something, whether it's volunteer, whether it's donate, whether it's share. There's something you can do no matter what your economic. And if you need it, go to it. Go, yes, see it. They're there for you. They want to help. They want to be there for you.
And if I may, I was going to say, if individuals would like to have a tour of the clinic, feel free to, again, visit the website and since info@rifreeclinic.org, and we can arrange a tour. So you can see, we have state-of-the-art facilities. So just like a doctor's office that you would expect, that's what we have here. And yeah,
it's a beautiful office, and they do so many good things, and they help the people who really need it. Forrest, give us a complete wrap up of why people should get involved and why it's so important for another 25, 50, 100 years and keep it going.
Sure. So kudos, first of all, to the legislators here in Rhode Island, because really about 97% of Rhode Islanders are covered. Okay, that's huge. And of course, when the Affordable Care Act came, that helped as well. But then there's still that 3% or 45,000 medically uninsured men and women that they're medically uninsured. And so that's why the Rhode Island Free Clinic exists, to care for those individuals who don't have insurance. They make too much to apply to be eligible for Medicaid, but not enough to buy into an employer insurance or what have you. So those are individuals who are right in the gap. We need to be here. And we've also shown the value that we provide to the state of Rhode Island by saving a little over $4 million a year by preventing men and women from going into the emergency departments and things of that sort. We need additional funding to maintain our operations, to maintain our core staff, and to expand, perhaps, as you mentioned also, Tina, for additional primary care, part-time, anytime is helpful. And we provide, sufficient training, things of that sort, and resources to make persons feel comfortable. If you don't speak or don't use electronic medical records, we have medical scribes, volunteer medical scribes on site. We have medical interpreters who volunteer. We've got, again, medical assistants. So we provide all the support that a provider would need to provide care to our patients. So thank you for considering donating time and resources to us. And thank you, Tina, for giving us the forum to speak with your audience. And of course, think the world of you. I'm here to support you and what you're doing too. So thank you.
Thank you for all that you do for us. Thank you for sharing all the amazing work that the free clinic does. We are so thankful you have been there for the last year, and I'm so thankful that you're my buddy. So that makes it good. So if you guys forget how to get in touch with the free clinic, you can always reach out to me, and I can make sure that I put you in touch with them. But help out in any way that you can. Thank you so much, Forrest, for sharing everything with us. I truly appreciate it. I want to invite you all back to stay in touch with RAMP. Unfortunately, for the next couple of weeks, I will be traveling. I will be going to Puerto Rico for my mission trip to go out and build housing. So all of our podcasts are going to be turning into live streams. We're going to live stream as much as possible in the next couple of weeks. And then June is going to be very busy because I'm going to Washington. So we will have a couple of podcasts, but they will be guest hosted. But the live stream will be up and running always. There was always a way to get in touch with me. And as I always say, don't just sit there, make a difference. Have a great day, everybody.